everyone. Today, we're diving into a pretty powerful pain medication that works around the clock, Piroxicam DT. Now, if you're someone who deals with chronic pain, you know the idea of a single pill providing all-day relief sounds like an absolute game changer. But how does it pull that off? And, what are the trade-offs? Let's get into it.
And that really brings us to the big question, right? How can one little pill possibly knock out something as stubborn as arthritis pain for a full 24 hours? Well, the answer is pretty fascinating, and it's all about its unique chemistry and the journey it takes through your body.
Okay, so first things first, let's make sure we're all on the same page. What exactly is Piroxicam DT?
Piroxicam belongs to a family of drugs you've almost certainly heard of, NSAIDs. That stands for non-steroidal anti-inflammatory drugs. Now that non-selective part is really important, and we'll circle back to that in just a second. But what about the DT? That's simple. It just means it's a dispersible tablet. You see, it's made to dissolve in water, which is a huge help for people who have a tough time swallowing pills. Plus, it helps it get into your system just a little bit faster.
All right, now for the main event. How does this drug actually work? How does it stop pain and inflammation right in its tracks?
To get this, let's try a little analogy. Think of it like this. Your body has an alarm gate, which scientists call the COX-2 enzyme. When there's inflammation, this gate swings open, and that's what triggers the feeling of pain. Piroxicam's job is to come in and lock that gate shut. Simple, right? But here's the catch. Because it's non-selective, it doesn't just lock the alarm gate. It also locks another really important one, the stomach protection gate, or COX-1. This gate's job is to keep your stomach lining safe and healthy. So yeah, the pain alarm gets silenced, but at the same time, the stomach's main defense system gets shut down too. This one single mechanism explains both its incredible power and its biggest risk.
So once you take it, Piroxicam starts this pretty amazing journey inside your body. Its whole mission is to seek out and quiet down inflammation. Let's follow its path.
This number, this is probably the single most important thing to understand about Piroxicam. 50 hours. That's its half-life. That's how long it takes for just half of the drug to leave your system. Now, to put that into perspective for you, the half-life of something like ibuprofen is only about 2 hours. This incredible staying power is the real secret behind why you only need to take it once a day. But, a long half-life like that is a classic double-edged sword. On one hand, the benefit is obvious. You get lasting relief from one pill, which makes it so much easier for people to stick with their treatment for chronic stuff like arthritis. But on the other hand, the risk is just as big. If you happen to get a side effect, well, that side effect can also stick around for days. And that long duration also raises the risk of the drug building up in your body over time, which could potentially lead to toxicity. So let's trace the drug's path. After you take it, it gets absorbed really quickly. Within a few hours, it's traveling through your body and starts to concentrate in the fluid around your joints, which is exactly where you want it for arthritis pain. Over the next few days, your liver works on processing it. But here's the key part. It can take anywhere from 7 to 12 days of taking it every day to reach what's called a steady state. That's the point where the level of the drug in your body is finally stable and providing that consistent 24/7 relief. Okay, so given everything we've talked about, when do doctors actually pull the trigger and prescribe Piroxicam? Well, its main job is tackling those chronic inflammatory conditions where its long-lasting effect is a huge plus. We're talking about things like osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. It can also be used for some short-term problems too, like a bad muscle injury or to manage pain after surgery. The standard dose is almost always 20 milligrams, taken just once a day, and this is so important to remember. That DT tablet must be completely dissolved in a glass of water and then taken right away. That's how you make sure it works the way it's supposed to. And now we've reached a really critical part of our discussion. Because of its strength and that super long half-life, understanding the safety side of Piroxicam is frankly non-negotiable for anyone who's thinking about taking it. Let's start with the more common side effects. Some patients might run into things like nausea, heartburn, maybe some stomach pain, dizziness, or even a skin rash. And while those are definitely no fun, they're generally considered less severe. But the real dangers, those are often hidden. While it's important to know about those common side effects, we really have to look past them to the more serious risks that require very careful medical supervision. And this is where things get serious. Remember that stomach protection gate we talked about?
Well, keeping that gate locked can lead to major gastrointestinal problems, like ulcers and bleeding. And it's not just about the stomach. There's also a higher risk of cardiovascular events. We're talking heart attack or stroke, and the potential for kidney damage. Plus, it can have some dangerous interactions with other common drugs, like blood thinners or certain kinds of blood pressure medications.
So, given those risks, there are definitely some groups of people who should just steer clear of piroxicam altogether. This is a hard no for anyone with a known allergy to other NSAIDs like aspirin, people who currently have a stomach ulcer, those with severe heart, kidney, or liver problems, and women in their third trimester of pregnancy or who are breastfeeding. This all leads us to the golden rule for every single NSAID out there, including piroxicam. It's the #1 guiding principle for both doctors and patients. Use the lowest effective dose for the shortest possible period. The goal is always, always to get the most pain relief while taking on the least amount of risk. And that leaves us with one final thought to chew on. For someone who lives with chronic pain day in and day out, is the powerful convenience of a once-a-day pill worth the need for constant vigilance and awareness of its risks? It really is the central dilemma of Piroxicam DT, a medicine that's both a potent ally in the fight against pain and also a pretty demanding one.